Unique people leading unique lives shape and inform Iowa City. This community is enhanced by these women and men who live in our midst, working, teaching, creating. Welcome to a series of conversations with people who have stories to tell. Join my special guests and me, Ellen Buchanan, in a series of interviews called One of a Kind. Dr. Ignacio Ponseti was born in Spain and received his undergraduate degree in biology and his medical degree at the University of Barcelona. He has been an orthopedic surgeon and professor at the University of Iowa for 43 years. Dr. Ponseti retired in 1984. However, as professor emeritus, he still consults and works in the lab. During his distinguished career, his interest centered mainly on congenital and developmental bone and joint disorders, skeletal growth disorders in children, and the biochemistry of cartilage. Dr. Ponseti took special interest in children with congenital club feet, and in the 50s developed a method for treating the deformity with limited surgery. He has served as assistant editor for the Journal of Bone and Joint Surgery, an examiner for the American Board of Orthopedic Surgery, and is past president of the Orthopedic Research Society. A visiting professor at nearly 100 institutions, Dr. Ponseti received the prestigious Kappa Delta Award for outstanding orthopedic research work in 1955. And 5 years later, he was awarded the Hecton Gold Medal from the AMA. And in '75, he was selected by the American Academy of Orthopedic Surgeons to deliver the esteemed Alfred Shands Lecture. Known for his extremely good rapport with his patients and as an inspiration to colleagues and students, Dr. Ponseti has helped hundreds and hundreds of children and adults. He and his wife, Helen, who is a retired Grinnell College professor and author, have lectured widely here and abroad. Dr. Ponseti has a son, William, and 2 grandchildren. Welcome to One of a Kind. This is going to be a wonderful show because your story is so remarkable.
Thank you.
I know your story begins on an island in the Mediterranean off the coast of Spain. You were born in June 1914. Your family moved to Barcelona. Why was that?
Well, my father and mother had 3 children, and they had to educate them. The schooling was much better in Barcelona than in the island, and I think that was the main reason why they decided to move to Barcelona while we were going to school, so it wouldn't cost so much.
So you have 2 siblings, a brother and a sister.
Yes.
And your brother, you told me before the interview, is still living and is an architect in Barcelona?
Yes.
And your sister has died?
Your sister has died, yes.
And tell me, what did your father do, Dr. Ponseti?
My father was a watchmaker and a jeweler.
And what brought you into, was it their encouragement, or did you, somewhere along the way, decide to become a physician?
Well, both. Maybe economics, in the sense that a career in Spain in biology or even mathematics is not very economically very difficult, because you have to join a university or college, while in medicine they are more, they are more outlets, really. And I was interested as a child, as a youngster, in biology, so that was a good compromise.
And you went off to the University of Barcelona and obtained your medical degree, but something happened, and quite a profound thing happened. War broke out in your homeland. Tell me about this part of your story.
Well, the Spanish Civil War started in 1936, just one day after I graduated. So that was a very tragic event for all of Spain, and I was in the midst of it. I had just graduated, therefore I was in the war immediately as a doctor, and I was joined. At first I was in the trenches, but after very soon I joined an outfit to treat fractures of the extremities and wounds of the extremities and the spine. And I was with this outfit for 2 years, and then I joined another one who was treating residual of neurological wounds, particularly peripheral neurosurgery. So I had a very extensive experience in the treatment of both war wounds of the extremities and spine, and then in the repair of neurological wounds.
Was the Spanish Civil War kind of became a testing ground for the treatment of war wounds?
Yes, we had one of the professors at the University of Barcelona, his name was Trueta, had studied in great detail and favored the treatment initiated actually by a Dr. Orr. Winnet Orr was professor at the University of Nebraska. He lived in Lincoln. And during the First World War, he developed a treatment of war wounds, which consisted primarily in just cleaning well the wound, the bleeding, removing all the dead tissue, and then putting a dressing and a plaster bandage over the broken, over the fractured extremity. This was, he published about this, and it was really tested on the grand scale only in Spain, since his technique was described just at the end of the First World War. During the First World War, like in previous wars, they were trying to treat wound infections or even wounds with disinfectants, trying to kill the bacteria, so to speak, in the wound. But that was never successful, because anything that would kill bacteria would kill the cells, the tissues that needed to be respected. And therefore, by cleansing the wound completely, removing all the debris, removing all the dead tissue, and just allowing for the body itself, nature, to take care of to prevent infections, actually, that was more successful. And that the doctor also saw that very clearly, particularly when he was transporting American soldiers wounded from France to the States. The trip across the Atlantic would take 2 weeks or so, 2.5, 3 weeks, and of course there were not enough people on board to care to dress the wounds and clean them every day, so they decided just to leave them alone under the cast, covered by the plaster cast. And when they arrived here, the wounds were much better. Dr. Trueta, who had a great deal of interest on wound infections, then kind of pushed most of the Spanish army to treat wounds that way. And that's what we did there. So on a grand scale, we treated wounds without disinfectant, just the breathe them on, thorough cleansing of the wounds, and then immobilization with a plaster cast.
So you were doing that, and then the Loyalists were, Franco was winning, and you fled then to France.
At the end of the war,
At the end of the war, you fled to France.
Yes.
And then what happened in your story?
As I had to evacuate, I evacuated a large hospital with officers and so on over the Pyrenees. And then in France, I found myself with, of course, the French soldiers, French surgeons did not have any idea of the treatment that had been going on there in Spain. So I was used there to, more or less, to continue the treatment of the officers I had evacuated over the Pyrenees. And I was in a base hospital then in France.
Then your story takes you to Mexico.
Yes.
You were wanting to get into the United States for further training.
Yes.
But you didn't have the amount of, you got $1,000, you needed $1,000 to get into the...
I didn't have any, but I needed, besides passport, you see. We moved we were pushed out of Spain by the Franco's armies, so we crossed the Pyrenees. We had no documents, I didn't even have my diploma. So I was without passport, without citizenship, actually. So Mexico invited a large number of Spanish refugees at that time in the concentration camps in France to go to Mexico, and we were given Mexican citizenship and then possibilities for working.
So how did you hear, and why Iowa? Why Iowa City?
Oh, when I, excuse me, when I was in Mexico, I met Dr. Faril. Dr. Faril was Juan Faril. Was the head of orthopedic surgery at the university there in Mexico, the head of the Children's Hospital, and he had in the early 30s, I think 30 and 31, a Guggenheim Fellowship for 2 years. And for the first year he stayed here in Iowa City. In the second year he was in New York at the New York Orthopedic Hospital and at the Hospital for Special Surgery, which at that time was called the Hospital for the Ruptured and Crippled, and 42nd Street. I met Dr. Friel when I got to Mexico City, and he told me about his training here, and he thought that Iowa City was better. Besides, I had, even before I went to Mexico, I had known of Dr. Steinler, who was the head of the orthopedic department in Iowa City, because Dr. Steinler, being from Austria, tend to publish in European journals, and he published several operations that he had devised here. So I was acquainted with the Steinler's name, and I was acquainted also with healthcare in Iowa, which at that time was very advanced. You know, we had, through the Perkins Act here in 1917, we had a very centralized form of government of healthcare in Iowa. Most of the difficult disorders and diseases and chronic diseases at that time, say bone tuberculosis or poliomyelitis or congenital anomalies, would come to Iowa City because the state supported this medical school.
Well, this mysterious diploma, there's a wonderful ending to that story. You had to flee without your medical degree,
Yes.
but your mother got it out of Spain, but 10 years later she mailed it to you?
Yes, she was able to mail it to me, I think 46, that's right, about
After you'd
8 years after, or
And-
9 years after.
And
I
then
left, yes.
eventually you were awarded by the University of Barcelona
You see.
an honorary degree.
Yeah, that was much later.
And quite a
Yes,
few years
yes,
later, but
yes, yes.
that must have been a thrilling experience for
Yes,
you to
sure,
finally
sure.
have it handed to
Yes.
you. Tell me, there's a wonderful story I read about your accent, that you were going to try and maybe change it a little because you were worried that
Yes,
maybe your
yes,
patients...
Yes. Well, yes, I wanted to change my accent, but the speech and hearing department, here, speech department, Johnson was the head of the
Wendell
department.
Johnson?
Wendell Johnson. I went to see him because if he, you know, he thought to speak to the stutterers and so on, I thought it won't be difficult to change my accent. But the dean of the medical school, Dean McEwen, thought that would not be advisable because a little bit for somebody with an accent here and there in the university kind of gave some prestige to the place, you see.
I see.
Yeah.
So you never...
So I never got any classes from Wendell Johnson.
That's a great story.
Yeah.
Now, tell me, in 1955, when you were awarded that wonderful honor for your research, what were you working on at that time?
Oh.
In 1955.
Yes, that was the, I have been trying to develop an animal model to study scoliosis, spinal deformities. Deformities of the spine, even today, there is a large number that are of unknown origin, and they are called idiopathic. And, well, I was reading through magazines. I saw that there was an epidemic here in the Middle West of during the drought in the 30s. Cattle would eat peas, vetches that were resistant to drought, and they develop deformities. And this of the spine as well as joints, and this was published in Wisconsin. By Steinbach and Parsons. In Wisconsin, they had, even at that time, a very, very powerful biochemistry department. And they, so they studied the deformities caused by these vetches, and one of them was the sweet pea from the sweet pea seed. One of the deformities they produced was actual spinal deformities, and I took this paper and start to study as to why did the spine curl in these animals, you see. And I started with rats, and there's a number of lesions that that I studied then, and the pathology of these lesions, like perthes and slipped epiphyses and scoliosis and so on. So the cause of all these disorders was that the sweet pea seed had a chemical, a nitrile, that interfere with the synthesis of collagen. The collagen is the substance that holds the tissues together. If you interfere with the synthesis of collagen, then you have, the things are not holding well together, and you have all these deformities. And the study of the pathology of this and the biochemistry then was of great interest, not only for the orthopedists, but for the biochemists, the people studying collagen. And so that's why I was given the prize.
That's wonderful. At the same time then, about 5 years later, you were given another award, this time the Hecton Gold Medal from the AMA.
Yes.
And at about this time, you met your wife, Helen.
Yes.
Is there a story about how you two met? Because she's also Spanish.
Yes. Actually, we met, but we didn't know that we had met in Spain because her family and my family used to spend the summer in the island of Mallorca, about 5 miles one from the other.
Was she born in Mallorca?
No, she was born in Valencia, but her father, who was professor of classics at the University of Valencia, they built a small house, this summer home in Mallorca, and my family lived about 4 or 5 miles from there. And their place was, their house was in on this seashore, on a beach area where only their house was there. And we used to go with some friends on a bicycle, often in the afternoons, to swim there. And we're always bothered by a young girl. My wife is 7 years younger than I am, who was around there. She had a donkey, and she used to come down with a donkey, so we couldn't swim as free as we wanted to. And but we never met, actually. And my family did not know her family. But then when we came here, I was introduced to her by the Macaños on a Christmas party. Macaños was professor of hydraulics here. Mrs. Macaño was professor of mathematics. My wife had come here to engage Mr. Macaño to give some talk or so at Grinnell College, and so that evening we met.
And the rest is you know, history.
Yeah.
Looking at your wonderful, productive, and interesting life, is there a person or an event that perhaps has shaped you?
Well, probably the event that shaped me most was the Spanish Civil War, obviously, because it changed my life completely. But there are a number of persons that while one goes through life is influenced by. I think as a youngster, my mother probably was the one who had more influence, more than my father, I think.
What was she like, Dr. Ponseti?
Oh, she was a very good person, and she always thought, wrongly, obviously, often, that I knew better, that I was not going to be in trouble and so on. So she allowed me more freedom that my father would have liked, and so I kind of sided with my mother, trying to do my best out of when I was out of college. Out of school. But then during the school years, I had some very good professors in Spain in the high school, professor of mathematics, and then through medicine, the professor of surgery, and so on. So, and the professor of physiology. So there are a number of people. And then here, of course, with Steinler was a great influence on my treatment of orthopedic disorders.
Well, you've certainly influenced a lot of people yourself, all the students and residents, and I had enjoyed so much reading all those letters from patients of yours who, these seem to be from children who are now adults who were born with club feet. This was a special interest of yours, and you followed these. You followed these, but you're still following these people 25 and 30 years later.
Well, that's one of the great advantages of practicing in Iowa, because the population is fairly stable. Families are very cooperative, and so you can follow these patients and know what really you are doing for them through their growth and development and into their middle age, which is very important. I mean, you're treating diseases and disorders and deformities of children. You have to know what is the long-range result, the long-range outcome of all these treatments that you are doing. And that's one of the strengths of our department here. We have in scoliosis or in dislocation of the hip or in all kind of deformities, club feet, for example, a long follow-up. Number one, because so many of these disorders were treated here. The state of Iowa never, until recently, paid any private doctor around the state to treat their children here. They came here to be treated with this. Say, if you had a child with a congenital deformity, then the state would take care of it. You see, the expenses were so high that you were made so-called medical indigent at that time, we used to call it, and you came to Iowa City and cost you nothing. The same thing with bone tuberculosis at that time, or osteomyelitis. All these disorders came here, were centered here, and were treated and followed here, so that we knew, probably better than any other place in the States, what was the natural the history of the disease, and how best you could influence it by your treatment. So.
Well, the letters were wonderful from those patients.
Well, this is one of the great pleasures, really, and rewards of being a doctor, is that you have, of course, the satisfaction of seeing patients who do well, and then the satisfaction of teaching here. There is a very good training center for specialists here. And of course we had treated hundreds of orthopedic surgeons who are now not only in the States but throughout the world. And this is one of the great rewards, I think, of my life.
So you've had research, you've been a teacher, and you've treated patients. I won't ask you to tell me which one you've enjoyed the most. It sounds like you've all...
The whole thing together.
Tell me now, you have a son named William and two grandchildren, and they live on the West Coast.
Yes.
Do you get to see them?
Oh, yes, yes. We spent usually summer together.
And you have a granddaughter named?
Yes, Diana.
Diana, and a grandson named?
Yes, Chris.
Chris. So you get to see them in the summer. I know the summers you are off hiking. This seems to be a passion of yours besides medicine.
Yes, we like hiking. My wife and I are good hikers, even at our age.
But you've hiked all, I mean, you've in Canada and in Switzerland. I mean, these aren't just little morning hikes. I mean, you're going to the summits, right?
Yes, and we walk a lot. We've been in Norway. We train, by the way, the head of orthopedic surgery in Norway, Medbø, who died some years ago, but when he was alive, we walked from Trondheim all the way down to Bergen. Taking from that time, you got at the fjord, and you take a boat and then cross the fjord, and then you kept on walking, and we took sometimes a bus from, but mostly we're in the mountains. And that's the way we like to know the countries, you see, by walking around. So we have walked in France and Switzerland, in Germany, and here too in Canada and the Rocky Mountains in the States.
And do you walk when you're in Iowa City?
Yes.
To keep in training?
I never drive.
You walk and never drive?
Never.
You always walk to the hospital all those years?
Yes.
Tell me, besides hiking, what are your other interests that you enjoy?
Oh, I garden. I like to garden.
You garden?
Yes, I like to garden.
Flowers or vegetables?
Both, but now I discontinued the vegetables because there were too much work, and my vegetable garden was down at the bottom of the hill, and every time we wanted to get a tomato, we had to walk down, and that's too much work. So now the flowers are like.
Now your flowers.
Yes.
And you travel up. I know you're retired, but you're still consulting, and you're
Yes.
still
Yes.
going to the hospital. And you're working on a book, correct?
Yes.
What is the
It's
book
the
about?
book on actually treatment of clubfoot and metatarsus adductors and other congenital deformities of the feet in babies. We have been very consistent in a type of treatment that I developed here in the late 40s. So since 1950 we have accumulated hundreds and hundreds of patients treated without surgery practically. There is a minor operation we do sometimes to transfer a tendon, but basically it's just by manipulation and application of plaster cast. The treatment, it lasts for about 2 months or so. And then if you keep the baby in a splint on shoes for several years at night.
They wear a splint, excuse me, at night?
Yes. The disorder, this clubfoot is a disorder of the connective tissue of the foot, that it retracts on the inner side, and so it deforms the foot. It lasts until about 4 or 5 years of age. Starts towards 14, 16 weeks of intrauterine life. We know that now that because with sonography you can see the foot starts to deform at about 14 weeks, say. 14 weeks. And then it goes on and it becomes severe at birth. But then even if you correct it, or even if you operate it, it will tend to retract until 4 or 5 years of age. After 6 years, it never recurs anymore. No matter even it's well corrected or not, it will stay as it is.
Then you get those letters saying,
Yes.
I'm now 25 and 30 and
Yes,
I'm leading a normal life.
Yes, yes. Most of them are very well, yeah.
Tell me, since you're retired, and we talked about your hiking and your writing and your gardening, and you go every summer to, you go back to Spain.
In the winter.
Oh, in the winter, you go in the winter.
Yeah. When it gets
For
very
how
cold in
long?
Iowa. About a month and a half, 2 months. About 2 months. Yeah. We live just before Christmas. We tend to spend Christmas with our family, and so we usually go to New York. And then we stay in New York for about 2 or 3 weeks, and then we go to Mallorca. And then we spend about 2 weeks in Barcelona, and then we come back to Iowa.
Has retirement been like you thought it would be? I mean,
yes and no. When I retired, I was 71. I worked until 71. And I thought that I should do something else. And I went to study Renaissance, mostly North European Renaissance. I like art all my life. I wanted to study art in greater depth. And I was in the art department for 2 years. But afterwards, a new technique came for me to start to work in the laboratory to study elastic tissue, and so I went back to the laboratory. And so I'm very happy that I took these 2 years off, so to speak, but in art I felt a little bit like a dilettante. I didn't know much about it, obviously. While when I went back to the clinic and to the lab, then I felt that I knew more things that I knew.
So it's a nice balance then,
yes.
travel and work and consulting.
Yes.
And
Yeah, I feel very strongly that if a man or a woman likes their work, it's best perhaps if they continue that same type of life during their retirement to be productive. You are productive in your field. You cannot possibly be productive if you move around into another field where you have to start from the bottom. Right?
it's like what Joseph Campbell says, you're following your bliss.
That's
it
right.
sounds like
That's
it.
in a way very good, very well put.
Thank you for coming. This has been wonderful to talk to you.
It was a pleasure to be here.
My guest has been Dr. Ignacio Ponseti, distinguished professor, researcher, and physician, whose full-time career spanned 43 years at the University of Iowa. A native of Spain, Dr. Ponseti arrived in Iowa City in 1941 to begin his residency in orthopedic surgery. Beginning with his first publication in 1942 dealing with war wound treatments, Dr. Ponseti contributed more than 100 articles on basic science and clinical topics. His emphasis over the years has been on congenital and developmental bone and joint disorders, skeletal growth disorders in children, and cartilage biochemistry. Dr. Ponseti has been the recipient of innumerable awards and honors and holds honorary memberships in many international surgical societies. In 1983, an international symposium was held in his honor at the University of Iowa, attracting physicians from all over the world. To honor Dr. Ponseti's service to the University of Iowa, to medicine and to medical education, his colleagues and friends in 1987 established the Ignacio V. Ponseti Professorship in Orthopedic Surgery. His many interests include writing, hiking, reading, travel, gardening, and the arts. Physician, teacher, researcher, author, husband, father, and grandfather, Dr. Ponseti is indeed one of a kind.